when either quarantine or isolation is needed. This is really actually a model, the Dharavi model that we are adopting. Dharavi is in Mumbai, India. And it's been proven extremely successful in their containment strategy. And we hope to do the same and implement its 4 components, or rather 5 components of prevention, detection, through aggressive testing, tracing, isolation, treatment, and reintegration into the communities. Code will prioritize barangays with a high number of clusters, those who really need the additional hands. The DOH will not be leading on-ground execution. That will continue to be the LGUs. We will instead commit our technical and manpower support to help them crush the clusters. We will match their presence on the ground, help them with capacity building, and leave them much more able to respond against the virus. We also launched the One Hospital Command Center, which will ensure efficient health facility referral in Metro Manila. Moreover, the One Hospital Command Center will also facilitate medical transport and patient pickups, manage the use of critical care services, and ultimately reduce the time it takes for Filipinos to reach a hospital. The public may get in touch with the OHCC in 3 ways. First, you may download the Pure for Citizens application for your mobile phones for free. Second, you may call the 886-505-00 or 0915-77-7777 or 0919-977-3333. And third, through our QR codes that will be made available. Despite the modified enhanced community quarantine, transportation continues to be an important issue. And while many Filipinos are still at home, there are still many essential workers commuting daily. We know options are limited for many, but for those who are able, we encourage active transport, like bicycles, for example. With the help of the DILG, the DPWH, and the DOTR, we have revisited the policy on active transport and have signed a joint administrative order to improve the circumstances for those using active transport. We have also completed the health promotion playbook on active transportation, an implementation plan for LGUs that covers the health benefits of using a bicycle, guidelines on bike-safe urban planning, road safety in harmony with motor vehicles, and template ordinance so that they support users of active transport, especially our healthcare workers. There is still much to discuss and much to do. And we are thankful that of our friends working in hospitals and healthcare facilities across the Philippines. Over the past week, we have been engaging doctors, nurses, and other healthcare professionals who are at the forefront of this pandemic. When they collectively raise their concerns, we immediately reach out to them to touch base. We are now collaborating with them to find the gaps where we can further strengthen and localize the pandemic response. With their help, we can maximize this opportunity to prepare a revitalized healthcare response against the pandemic. Next week, we will provide more updates after further discussion, and we will be including other institutions who are joining us in this campaign, such as DILG, DOTR, and the DTI. Muli po, maraming salamat sa mga naglaan ng kanilang oras para daluhan kami sa meeting na ito. At pakiusap at paalala po namin kasama ng ating mga frontliners sa HIPAC, manatili muna tayo sa ating mga tahanan kung wala naman tayong importanteng kailangan gawin sa labas. Kung kinakailangan po talagang umalis ng bahay para sa mahalagang Tungkulin, ugaliin pong isuot ang mask at face shield dahil ito po lamang ang ating tanging proteksyon laban sa virus. Palagi rin po natin hugasan ang ating mga kamay o mag-alkohol kung hindi makakapagsabon at tubig sa lalong madaling panahon. At patuloy lamang po tayong sumunod sa physical distancing o ang paglalayo mula sa isa't isa ng 1 hanggang 2 metro at mas mahaba, mas maigi. Itong maliliit na bagay na ito ay maituturing natin ngayon bahagi ng new normal na mga small acts of kindness din dahil yung konsiderasyon na paggamit ng mga ito para hindi nga makahawa. Ito ay mga maliliit na gawa ng kabutihan dahil itong mga ito ay malaki na ang maidudulot upang di lalong kumalat ang virus at maaari rin makapagligtas pa ng buhay. Sa puntong ito po, muli ako ay nagpapasalamat sa inyong lahat. Thank you.
Maraming salamat po, Secretary Duque. We sure hope to continue this momentum next week, no, and until the coming months pa po. Now to share the ways forward and what the DOH is currently working on with the Health Professionals Alliance Against COVID, I'd like to call on Undersecretary David to apprise us. Thank you very much po, ma'am.
Thank you, Laura. Good afternoon, everyone. Good afternoon, Secretary Duque, and to our honorable guests from various medical societies. We thank you for all your commitment to maintaining our nation's health. Thank you as well to Secretary Duque for sharing with us the current progress in our COVID response, mainly the founding of coordinated operations to defeat epidemic or CODE, addressing issues in our hiring of healthcare workers, implementing an active transport protocol, and the launching of the One Hospital Command. Through a series of productive discussions with the representatives of our various medical societies, we were able to come up with ongoing strategies and ways forward in recalibrating our COVID response. To further talk about our ways forward following the issues raised during the forum organized by our comrades in various medical societies, 7 key issues were pointed out that we need to address. The number 1, hospital workforce deficiency. Number 2, issues of case finding and over-reliance on rapid anti-test kits and isolation measures. 3, deficiencies of contact tracing and quarantine. Number 4, transportation safety. Number 5, workplace safety. Number 6, public compliance with self-protection. And 7, reopening of industries. We have categorized this in different work streams that will allow us, working alongside with the representatives of HPAC, to further put details in our strategies and implement them effectively. As Secretary Duque has already discussed, the One Hospital Command code and a proposed working group that will enforce transport safety, let me build on the telemedicine mechanism of the One Hospital Command. We are now scaling up our telemedicine capacity by enabling local government units to engage telemedicine providers. Next, we would like to nudge them to renew telemedicine providers with an updated memorandum of agreement. And we are also redesigning the current call center flow to efficiently address both COVID and non-COVID telemedicine concerns. This is aligned with the recommendations of HPAC, which is ensuring that the public will not flock to healthcare facilities but can have adequate access, even in the comfort of their own home, to the information they need in terms of health-related concerns, be it COVID or non-COVID. This way, we ensure that we are capacitating our health system by properly triaging health concerns that come in our pipeline. In further supporting our health workers and immunity with HPAC, the DOH has proposed a working group that will look after our health workers' welfare, which is coupled with a surveillance team for a more efficient contact tracing on the event of infection. Another proposed working group ensures workplace safety. also coupled with a surveillance team to minimize virus transmission in the workplace. This is already being coordinated with the DOLE, DTI, and specific resource persons referred by the medical societies to craft industry-specific workplace guidelines. We have also already started drafting key action points for partners, which will be vetted soon by the Executive Committee of the Department of Health. We again thank the Health Professional Alliance Against COVID-19, HPAC, for carving out time to discuss with us how we can recalibrate our COVID response. We at the DOH are eager to maintain a collaborative relationship with HPAC as we further progress in rising above the pandemic in an informed, strategic, and impactful way. We would also like to thank our so-called homeliners who tirelessly complied with the modified enhanced community quarantine directive of staying home and only going out for essentials. To those who are going out of their house for work and other important purposes, we thank you for remembering to wear a mask, face shield, and practicing physical distancing. Please continue to be part of the solution by practicing the minimum health standards and maintaining optimal health conditions. This way, even in our own way, we can protect ourselves from contracting the virus. We are one with HPAC when they pronounce that we are the first line of defense as we protect ourselves from contracting the virus, and that we must consider our health workers as the last line of defense. We now turn over to the representatives of the Health Professional Alliance Against COVID-19 to tell us in a more detail about the specific projects we are currently working with them closely. Again, thank you very much.
Thank you, Yusek David. Really, the collaboration between the DOH and the HPAC is going well. We hope moving forward that next week we'll continue to have fruitful discussions. Now may we call on Dr. PCP President Dr. Mario Panaligan for a few words. Doctor?
Magandang hapon po, at saka maraming salamat, lalo na kay Secretary Duque at saka kay Yusek David. At magandang hapon po sa kanilang lahat. No? Unang-una, kami natutuwa sa pagkatapos of course na masabi namin yung mga immediate concerns or issues last week. Kami ay naging kasama dahil naman ang aming hinihiling. Pangalawa, at lubos kami nagagalak dahil naging kabahagi kami sa pagbuo ng isang komprehensibong programa para mapigilan pagdami ng mga COVID cases sa NCR. No? Indeed, we are not actually happy to become the epicenter of this COVID-19 pandemic in Southeast Asia. Although we were able to overtake the numbers, we are now number one, overtaking Indonesia. But definitely not going to rest, no? And we were not going to relax because that will be equivalent to being complacent, no? In terms of how we can do, on what we can do in terms of preventing the acquisition of this COVID-19. And when I said complacency, we should not actually forget doing what we must do for, as always, like, for example, the hand hygiene, which is very, very important. And of course, physical distancing. And right now, I'm happy that, of course, the facial shield is now going to be used, no? In addition, of course, to the masks when we go out, and in fact, soon when we go to work, that should also be used, not only in our workplace, but even, of course, in the public utility vehicles, as we have heard in the news. And of course, we will remain vigilant, because that's quite important. We shall continue monitoring in terms of what we are doing in terms of the problems that can be associated with the different measures that we're going to implement. Very, very crucial is, of course, the re-education, refamiliarization everybody in terms of the importance of protecting ourselves. Kasi ang pinakamahirap yung lagi natin nakakalimutan o nagiging habit natin na magandang kasama yan, lalabas muna ako. Nakakalimutan natin na mag-ingat Yun ang laging problema. Kasi pag ginagawa natin ang mga gusto natin gawin, syempre nakakalimutan natin na maglinis mo lang ang kamay pag may nahawakan tayo. O kaya naman mahilig tayo maghawak ng ating mga ilong pag nangangati. When in fact, titingnan muna natin, alalahanin muna natin mga kamay natin kung marumi ba siya o hindi. Kasi hindi natin alam, baka may nahawakan din tayo na contaminated pala ng COVID-19 at ganun-ganun na lang, mahawak ka na sa iba. Kaya importante, huwag tayo makalimot. No? Paulit-ulit ko sinasabi yun na pagka meron tayong nahawakan, linisin agad natin kamay natin. Kaya nga sabi ko doon sa nung na-interview rin ako, I really wanted to emphasize the need to be very cautious in terms of what we handle. So when we ride the bus, we need to be very careful when we are touching any handles because that can easily be contaminated and therefore we need to clean our hands constantly. And therefore, part of the plans or along with the framework that we have developed, of course, is the intensification, of course, of the contact tracing, and that has been discussed well. Certainly, we'll intensify that through, of course, our LGUs. Definitely, they will be very, very helpful in terms of minimizing, of course, the spread by identifying who got exposed, even to the second and third encounters or third-degree encounters. Of course, the detection, that also will be intensified, and I'm happy for all the plans, particularly, of course, the plan not to use, of course, the rapid antibody tests that have been very popular because there are, of course, lots of failures that could have led to the surge in the number of cases, particularly in the LDUs. And then, of course, it's quite crucial, really, to make sure that we always monitor. If there are signs of failures, we have to move fast. We have to act immediately so that we will avoid any kind of spread because we don't have any solution now. And therefore, what we are doing, like these preventive measures, will help a lot. This will definitely help decrease or control the spread of this virus. And therefore, we can definitely prevail against this pandemic for as long as we remain conscious in what we do. So thank you very much, sir. Thank you very much to all for all the work that we have had. And I really thank you, the HPAC, who has helped in terms of creating all these programs or plans and then integrating all of them because we have really recognized the problems and therefore it's not as simple as we have thought of because it should be a combined strategy certainly and this will definitely help control this pandemic. Again, maraming salamat po sa kanilang lahat. Thank you.
So, Doc Mar, maraming salamat po sa inyong napakamagandang mensahe at kami po dapat ang magpasalamat sa inyo dahil inyo pong tinawag ang amin pansin para tumugon doon sa inyong mahalagang abiso for a time out yung inyong manifesto at nakapagbigay po ito ng tinatawag natin window of opportunity para talagang to reassess and to review and therefore to recalibrate our response. At maganda po ang nangyari dahil tingin ko ngayon mas ang pakikipag-ugnayan sa mga medical professional societies and major healthcare associations ay para bagang biglang umusbong at naniniwala po kami na ito ay magiging magbubunga ng magandang mga resulta. sa ating pong tugon sa pandemyang COVID-19. Hindi po madali ang trabaho. Sa totoo lang po, napakamahirap po talaga ito. At lalong-lalo naman po yung ating mga frontliners, ang ating po mga doktor na nangangalaga sa mga pasyente at ang nagpapasalamat din po ako sa ating mga magigiting at magagaling na mga doktor na sa kanila pong malaking naiambag sa relatively yung mababang bilang ng ating mga pumanaw. Siyempre, kahit na isang buhay, hindi dapat mawawala. Hanggat sa maaari, maiwasan natin ang pagpanaw ng kahit na sino man. One death is always a death too many, and we do not like that. But just the same, it does not digress from the fact that I think the clinical case management has somehow improved much more than during the first time when we had the surge in March, no? So ito po ay talagang amot langit ang aming pasasalamat sa katapatan at sa kabayanihan ng ating po mga healthcare workers. At alam ko kasama po kayo dyan sa mga yan, kung hindi man direktamenteng nagbibigay ng kalinga at paggamot, ay ang inyong paggabay ay ganun din mahalaga sa ating pong pag-asikaso at pangasiwa ng lahat ng mga COVID cases. So muli, salamat. Maraming salamat po.
So, thank you, Dr. Mario Panaligan. Thank you, Sec Duque. So, two things, no? Resilience and vigilance. So, it's going to be, no, hindi na sprint, but a marathon. So, resilience is important and vigilance po, no? Ngayon po, maaari po ba nating marinig ang mensahe ni Dr. Maricar Limpin, ang PCP Vice President po? Dr. Limpin?
Yes, magandang hapon po sa inyong lahat, and Secretary, magandang hapon po.
Good afternoon, partner. Tagal-tagal na kitang partner sa FCTC pa lang. Tagal-tagal
Yes.
na mula nung unang panahon.
Yes, sir. Sir, yes, tama po, no? Kaya actually dito again, gusto ko talagang ipaabot din sa ating mamamayan na naririto ang gobyerno at kaming mga health professionals na tulong-tulong na nilalabanan ang COVID-19. Siguro pagkakataon na rin ito para bigyan din natin ng panawagan ang ibang government agency, kasi importante po na matulungan po kayo, the Department of Health, sa pagpapa-implement po ng mga programa na ilatag nyo na. Actually, maski nung umpisa pa lang, nakita ho namin na nasa tamang direksyon naman po kayo, except siguro hindi po na-i-implement sa mga local government units, no? So, importante po, siguro dito, importanteng manawagan ho tayo. Mananawagan ho kami na importante talaga yung kooperasyon ng bawat isa, no? At saka yung di lang po Department of Health ang kailangan dito na kumilos, kailangan talaga the whole of government. So dito, DILG, mga local government units po, sana po sama-sama tayong magtulungan at sundin po natin lahat ng mga programang na nakalagay na diyan, no? At i-institute ng Department of Health, kasi so far nakita ho namin na nasa tamang direksyon na ho tayo at kailangan lang ho tayong wag bumigay, no? Kasi pag bumigay ho tayo, diyan ho tayo magkakaroon ng problema. Nananawagan din po ako doon sa telecommunication agency ho natin, no? Kasi napinangungunahan ni Ginoong Honasan, dahil po importante ang telecommunication dito sa kampanya laban sa COVID-19. So na siguro kakalampagin lang ho natin para po mas maging mapagtagumpayan po natin ang lahat ng mga programang nasa isip at isasagawa ng Department of Health, at kami na rin po doon sa health sector. So sa ating presidente, kay Secretary Duque, no, I think dito pinapakita ho natin, this is really one Philippines, isang bansa na nagkakaisa para po manalo tayo against COVID-19.
Thank you, Dr. Limpin, and thank you, Dr. Panaliga, for sharing with us your insights and recommendations in recalibrating our COVID response. We look forward to the continued collaboration between the DOH and your alliance po as we continue our work in beating this pandemic. Before we end, may I just please call on our DOH spokesperson, Yusek Vergere, to give a few closing remarks. And then after, we will have a quick photo opportunity with all the speakers. Yusek Vergere, please.
Yes, good afternoon, everybody. For us to close this mini press con and end activity, we just like to make mention that the DOH will continue to focus on how we can bring more support from the national, from the regional, and from the provincial levels down to the communities and to our households. We will continue to work closely with the medical societies to bolster the pandemic response in a timely, quality, and patient-centered manner. In the meantime, we ask that everyone observes the minimum health standards, even if we are in the MECQ. It's a small way for all of us to be part of the solution to COVID-19. It could have a big impact on slowing the spread of this infection. We are one with HPAC when they pronounce that we are the first line of defense as we protect ourselves from contracting the virus, while we must consider our healthcare workers as the last line of defense. In ensuring we don't overwhelm our last line of defense, we must act now. We call on everybody to be the solution and act in the most responsible way so that we protect ourselves and the people around us. Thank you very much.
Thank you, Yusek Vergere. MRU, can we now take a photo of the participants? Thank you.
May we request everyone to turn on their cameras so that we can take a group photo. Okay. 1, 2, 3. Okay. Thank you, everyone.
Thank you, everyone, for joining us today.
Salamat po.
Maraming salamat po sa kanila.
Continue to work closely with everyone so we can localize our patient-focused approach to the pandemic and bring it down to every household. We will be providing updates once again next week on what is further being done to bring down the support from hospitals to the communities. We ask everyone to continue to be part of the solution by practicing personal protective behaviors such as wearing of masks and shields, physical distancing, and constant hand washing. This will not only keep ourselves safe, but also our loved ones and those around us. Thank you very much again.
Thank you, partners. Partner Mar and partner Maricar. Sana ito mas madalas natin ginagawa at naniniwala ako na ito na ang direksyon tatahakin natin sabay-sabay. Maraming pong salamat. Mag-usap tayo, Mar.
Apo, maraming salamat po. Sir.
Thank
Maraming
you,
salamat.
everyone. Thank you.
Maricar, maraming salamat. And
Maraming salamat.
Team DOH, as ever, hardworking, dedicated, tireless, wala nang tulog, wala nang tulugan. At di nga alam, minsan lumalaki ang mga bewang dahil kulang na sa exercise.
Tuloy-tuloy ang expanded targeted testing ng pamahalaan sa ilalim ng DOH para malabanan ang pagkalat ng COVID-19. Sa ilalim nito, bibigyang prioridad ang mga taong may mataas na panganib na mahawa o magkaroon ng komplikasyon dahil sa COVID-19. Unang itetest ang lahat na may malalang sintomas ng COVID-19.